This week we are doing chapter 5, and this is the integumentary system. And as we've said before and previously, the skin is the largest organ system in your body. And here is a diagram of your skin and the makeup and the structure of your skin. And we already talked about you have two layers of skin. The epidermis is the top layer, and then the dermis, of course, is the bottom layer. And then I told you before that some people usually say that the subcutaneous tissue is also a layer of skin. But as you can see here in representation, that is really just fatty tissue or lipo tissue right there that is right up under the dermis of the skin. Now, the anatomy and medical terminology of the skin, we've already talked that the skin is the largest organ system in your body. The epidermis is the outermost, the dermis being the innermost portion of the skin. Now, the dermis, the epidermis, it contains different types of cells. The most common cells are squamous cells. And this is flat, scaly cells on the surface of the skin. And those are cells that have died and gotten hard on the outside of your skin. That's what makes up your epidermis of your skin. Then you have your basal cells, or these are round cells, or in melanocytes, or the color pigmentation of the skin. There are 4 to 5 layers of skin. You have the stratum corneum, the stratum lucidum, the palms and the soles of your feet, the stratum espesum, and the stratum basal. So the dermis is the under the epidermis and performs the most functions of the skin. The dermis consists of blood vessels, connective tissue, nerves, lymph vessels, glands, receptors, and hair shafts. The dermis is made up of 2 layers, and that is the upper papillary layer and the lower reticular layer. Also in this chapter, we will talk about chapter 2 of your ICD-9 book right now, and that is going to be your diseases of the neoplasms. And you know your neoplasm is a new growth. The neoplasm table is one of the 3 tables that you currently have in ICD-9. The neoplasm table is broken down into 6 columns. The first 3 columns indicate malignancies, which are classified as primary, the first time you've been diagnosed with cancer. Secondary, it means that there is a new occurrence of cancer other than the primary site. Then a carcinoma in situ, and this is after the malignancies. It is encapsulated and it is not invading on normal healthy tissue surrounding it. Then after that, you have the malignancies are columns for benign, uncertain behavior, and then unspecified. So make sure you go back and you look over these definitions: primary, secondary, in situ, benign, uncertain behavior, and unspecified. Make sure you know the definitions of those. And here is a copy of your neoplasm table. So if you were looking up a basal cell carcinoma of the eyelid, first thing you would do is look in the neoplasm table for skin. Then where's the skin that you're looking for? Eyelid. And then what type of cancer of the eyelid? You want to see a basal cell carcinoma. So, and if it were primary, it would be 173.11. Okay. Okay, these are just some more examples. So it gives you a chance to go back and look over it. So make sure you know. The next thing, there are some diseases of the skin and subcutaneous tissue. The skin infections can be either bacterial or fungal. Inflammatory conditions of the skins, including dermatitis, erythema, rosacea, and psoriasis. Other disorders of the skin, including corns, calluses, keloid scars, keratosis, diseases of the hair, such as alopecia, diseases of the sweat glands, hidradenitis, diseases of the sebaceous glands, such as acne, and then you can have ulcers. Okay, and these are some more infections of the skin. So you can have, and one that you, skins can be bacterial or fungal. Carnabucles or funicles are boils typically caused by some kind of staphylococcal infections. Several funicles together make up a carnabucle and often involve a group of hair follicles. The fourth digit of the diagnosis code will depend on the location of the funicle or carnabucle. Another infection that you all will see a lot of and you'll code a lot of will be the cellulitis, and the abscesses of the skin are coded using the same subset ICD-9 codes from category 681. Cellulitis and abscess of the finger and toe are in category 682, and it is other cellulitis and abscesses. Cellulitis itself is a bacterial infection in the deeper subcutaneous tissue. The selection of diagnosis code will depend on the location of the cellulitis or abscess. In addition to the cellulitis code, you will also need to code the organism causing the infection, such as if you have a staphylococcus. Okay, that is if known, you all. Sometimes it will be listed and sometimes it won't. You have other inflammatory conditions of the skin, such as erythema. Erythema is a redness of the skin due to a capillary dilatation. There are types of erythema, includes rosacea, erythema multiforme, erythema nodosum, and erythema multiforme is documented, and you will report the code for erythema multiforme, and those are the code ranges right there. You can have associated manifestations, and the additional codes from these code ranges to identify the percentage of skin exfoliation, and in addition to any E code to identify the drug if drug induced, because you can have drug induced erythema as well, and a real bad allergic reaction to a drug. Other diseases in tissue and subcutaneous tissue, the other diseases of the skin include corns and calluses, keloid scars, keratosis, diseases of the hair such as alopecia, sweat glands, hidradenitis, diseases of the sebaceous glands, and which would be acne, and then you have ulcers. Keloid scars are excessive growth of connective tissue in the healing process, and you've seen anybody who have that really prevalent scar, really dark in color, that is usually a keloid scar. Keratosis is an overgrowth or horny layer of the skin. Actinic keratosis is also known as keratosis caused by sun exposure. Actinic keratosis is also known as precancerous because it can be the first step leading to a squamous cell carcinoma. Seborrheic keratosis is a benign growth that is typically not cancerous, such as you have warts, also are grown on the skin and are typically caused by human papillomavirus or HPV. Keratosis is coded from category 702, while warts are mainly coded from category 078. That's some good little tidbits to remember, you all. All right. Alopecia is hair loss. Alopecia is an autoimmune disease where the immune system mistakenly attacks hair follicles, causing hair loss. Telogen epilum is alopecia caused by metabolic or hormonal stress by medications. Now, an ulcer is a lesion on the skin caused by a superficial loss of tissue. In ICD-9, skin ulcers are selected based on whether the skin is a pressure ulcer and by location. Pressure ulcers are known as bed sores or decubitus ulcers. They occur when there's a loss of tissue due to pressure on the skin. The pressure ulcer is reported from a category of 707.0. An additional code for the subcategory 707.2 must report the stage of the pressure ulcer. Okay, so make sure you use two codes when identifying a pressure ulcer or bed sore. Injuries and poisonings. Let's go on, and this is in chapter 17 of your ICD-9 manuals. You have injuries of poisonings are opening wounds, superficial injuries, contusion, intact skin surface, and burns. Lacerations to the skin are coded as open wounds. In ICD-9-CM, look for O wound, then open. The code is based on the location of the laceration and whether it is complicated. Complicated wounds are those that have displayed healing, delayed treatment, or foreign body infection. Now, y'all remember, lacerations are on the outside. Open wounds are on the outside of the body. Now, if you have a liver laceration or a spleen laceration, that's on the inside. Laceration will be referred to as wounds on the inside of the body, usually due to trauma. Superficial injuries are occurring on the outer layers of the skin, including abrasions. These are some superficial injuries, you all. Abrasions, blisters, insect bites, or splinters. Contusions are bruises or hematomas. Superficial injuries and hematomas should be coded when they are a part of more serious injuries to the same site. Burns are based on several factors. When coding a burn, you need to make sure you know the location as well as the degree of the burn, as well as the total body surface area. Look at this right here, you all. Remember the different types of burns that you can have. A first degree burn looks kind of sort of similar to a sunburn. A second degree burn will also be called a partial thickness burn. And a third degree burn right here, such as here, is a full thickness burn.